on First News at 4, we've been talking to you all week about how to try to stay mentally healthy during the COVID-19 crisis. But a lot of our focus has been on children, or it's been on families, or it's been relatively general. So today we wanted to get specific, talk about how our seniors can keep their minds healthy during the outbreak. That's why we're joined by Marcia Ori today. She's a Regents and Distinguished Professor at Texas A&M University, where she also serves as the founding director of the Center for Population Health and Aging. She has degrees in chronic disease epidemiology, sociology, psychology. So Dr. Ori, we appreciate you joining us. My first question today, if any older Americans are watching the news, they've heard over and over and over again that COVID-19 coronavirus can be especially bad for seniors and particularly deadly for seniors. How is this making seniors and older Americans feel?
I think it's making them fearful, but I think the message needs to be, don't be fearful, be concerned, know all's the best public health practices. So right now, social distancing is important. Seniors should adhere to that, but it doesn't mean that they have to be socially isolated. They should just remove themselves from being close to others.
So yeah, let's dig into that, because for so many of our seniors, socializing is a key part of staying mentally healthy. How are seniors socializing without compromising these social distancing regulations?
I think there are things you can do. The old-fashioned thing is to get on the phone and talk to your family and friends, to your neighbors. For those people on Facebook or FaceTime, you can check, because I think it is important to be able to see people. You may not be within 6 feet, but you can at least communicate and check in. So as an older person, check in with other people in your neighborhood. And I think the message that's gone out to people who are younger, check in with your families and neighbors. So we don't want older people to be socially isolated.
Yeah. What unique problems do you think seniors are facing right now during this crisis? The ones that maybe a lot of us don't even think of?
Well, I think seniors get the message, be physically active, eat well. And so there's this whole issue about how can I be physically active if I have to stay at home? And so the issue there is take a walk with your dog. Just be sure that you're not walking with packs of people. The other thing that seniors can do is enjoy nature. The weather has been beautiful lately. So don't just be sitting there glued to your TV, but look out the window, enjoy the beauty of spring, the greenness, the birds. These are things that people can do to stay mentally healthy and cognitively alert.
So what are your big concerns, Dr. Ori? Is that your big concern, that seniors might just really get into that isolation bubble and forget to reach out beyond it?
Exactly,
Yeah.
because it also depends, all seniors are not the same. Some, and about 40% of seniors, do say that they're lonely. Others are very socially active. So being, on social distance guidelines is difficult for the person who's been used to being active, as well as also difficult for the person who's been isolated. So the key is stay connected. Find ways to stay connected. And the key is you as an older person can be calling and doing things for others. Volunteering is so important. So don't be sitting here feeling sorry for yourself. Think also how you can be helping others.
Some stores are doing this senior hour thing to protect and keep older Americans away from the virus, or at least try to slow the spread there. How important is it to make seniors who still have to go out in the world, how important is it to make sure that they feel safe and are safer?
That is a great public health practice that actually stores are engaging in. I think that for the older person who would be nervous, it gives them an opportunity to go when the stores are less crowded, they're less likely to be near other people. I think it's an excellent idea and strategy. It's really what I would call a private-public partnership that's to the good of all, and particularly good for seniors.
Yeah, you've touched on this just a little bit, but at the end of our interview here, I want to reiterate this. What can all of us, those who are not necessarily older Americans, what can all of us do to help protect and support the mental health of the older people in our lives who we love?
I think it is stay connected, stay, be good to your body. So stay physically active, eat well, be connected. And I guess the other thing is unwind. Don't be listening to news 24/7, because that will make you upset as you see the numbers grow and grow and grow. So get news from reliable sources like your station, know what the public health guidelines are, and follow them.
All right. Marcia Ori, she's a Regents and Distinguished Professor at Texas A&M University. She's got degrees in sociology, psychology, epidemiology, and she is the founding director of the Center for Population Health and Aging at Texas A&M. Dr. Ori, thank you so much for joining us today.
And thank you for having me.